Hey.
Hello.
All
How
right.
are you? How's it going?
It's good. It's good. How are you?
Oh, just doing my best out here. That's all we
Working.
can do, right?
Yeah. Been trying to keep up with, my wellness techniques that I
Yeah.
talked.
Oh,
Yeah.
all those good wellness techniques. I just had a quesadilla. It was a great time. I was it was a long afternoon of meetings today, so I was happy to get that in before this today.
Same. I actually didn't get a chance to do anything, but I plan to take my dog on a long walk
That's
later.
good. It's like it gets dark so late now, I feel like. Like it's like 7:30 and it's still light out. Oh no, Dave, what happened? All right. We'll figure out what's going on. Stay tuned, everyone. Uh, love these technical difficulties. We back? We good?
Yeah, I got
Cool.
kicked off the Wi-Fi somehow.
No worries.
But yeah, later. And so it's gonna be good. Oh, I see a few of my friends are joining. Hey, Janelle. Glad you could join. Today's topic. Like,
Yeah. Stick
yeah.
around. What was I going to say? Oh, yeah. I finally went to the grocery store on, what was it, Monday? Monday morning. I went for the first time in like 2.5 weeks. Um, so now I have food and I can make things like quesadillas. It's wonderful. Before that, I was like surviving on just like solely frozen food that I had left, which
Yeah.
is not good for any sort of wellness technique. So I feel like I'm restocked now and I'm like ready to go.
Yeah. See, no, I've been doing Instacart, so I haven't actually been physically to the grocery store.
Wow.
But I have to go. Like, I've been pretty much at home for the most part, but I have to go to Home Depot
Hmm.
first things because I had a leak in my kitchen, which I fixed myself because I got all this free time at
Oh
home.
no.
But
Yeah,
I
yeah,
gotta
yeah.
drop.
Well, I'm
So I
glad you
gotta
can
go get
fix it on your own.
yeah, I gotta go get some stuff.
Gotcha.
But
I understand.
yeah, so let's, audience, make sure you drop comments in the chat throughout our conversation. We will definitely love to address your questions, concerns, whatever you want to bring up. Um, just drop them in the comments and we'll try to keep up with those. But just to touch on, what Whitman-Walker has been focusing on during this time. So the Whitman-Walker Community Health Department really has expanded its outreach techniques. And we really moved towards social media. So this is why we're doing the Instagram lives and things.
Definitely.
Yeah. And so what we're doing now is covering various topics, some that include, HIV, STI, sexual health practices, access to care, social determinants of health, and just general public health interventions. We are basically here to help you all through this. And so our next series is going to cover, you know, the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health, all of that wellness. And so our community health team is here to educate and support you.
Yes.
You can find resources at our website, womenwalker.org. So always feel free to go to that site if you need some resources or you're looking for resources, or call us at the number that you see pinned here in the chat. So
Totally.
anything from you?
Well, I
Yeah.
think we should introduce ourselves. That
Yeah.
seems good. Y'all have seen us before, but like for anyone who's tuning in first time, we can go ahead. I'll just say my name is JJ. Hello. I'm the social media outreach coordinator here at Whitman Walker within the community health department. So all this transition that David just talked about, how we're really expanding our social media outreach, I've been involved with a lot of that. So I think it's been a really exciting time here, reaching everyone on social media. And I think it's really at least made me feel like a lot more connected to a lot of you, because that's really the best way that we can still talk to each other is online, over social media. It's such a great tool to get the word out about a lot of things. So that's my role at Whitman-Walker. My pronouns are he, him, his. You want to introduce yourself next?
Yeah, so I'm David Wilson. Um, Pronouns are he, him, his, like JJ. And I am a social media influencer within the community health group. So my focus has generally been what I'm doing now, educating on social media platforms about, community health. And so I've been doing this for a little over 6 months now. It's been fun. And, I look forward to continuous engagement here. So don't forget, drop your comments.
Yeah, let us know how y'all are doing. I know it's some tough times out there, so yeah, drop whatever comments or any questions you have, and we'll definitely answer those as we go on here.
Absolutely. And so, during this time of quarantine, we realized that everyone should be practicing social distancing. And
Yes.
social distancing, that includes physical from the general public. And we all know, we have a bae or maybe a boo or that special friend that we, maybe
A quaran bay. That's what the terms are, right? I feel like it's just quaran everything now. Quaran bay,
bae.
all those
But
things.
for those of you who aren't bae, we want to give a little bit of, advice, tips, resources so that you can maintain your sexual health responsibilities during this time. So again, drop your comments. If you have any questions you want us to directly address, feel free to put them there. So JJ, you work in community health. So
I
why is
do.
it so important to be mindful of our sexual health and the resources that are available during this particular time?
Yeah, so I think there is never a bad time to be mindful of your sexual health, right? I think we all need to be mindful of our sexual health whenever we're sexually active. But in these real weird, uncertain times that are going on, I think the main thing why we really need to be really pay attention to ourselves and our bodies is because that there's so much changing out there, right? Resources are changing, there's so much information out there. So maybe where you normally go to, seek out information on sexual health resources or to your doctor, things like that, all that's changing, right?
Right.
So I know Whitman-Walker has gone through a lot of changes in terms of how we're still seeing people. For example, we've had to suspend our walk-in testing and treatment services for HIV and STI until further notice with the pandemic and stuff going on. So I think with like the fact that so much has changed and there's so much different information out there, you really need to pay attention to like what you're seeing and how you're like really, I think, caring even more about your sexual health. I think the other thing why people need to be mindful about their sexual health now kind of goes back to how you discussed like the whole physical distancing and how that relates to your sexual partners. So we always talk about physical distancing, excuse me, but not social distancing. So
Yeah.
physical distancing, right? That means that we're abiding by the CDC recommendation, that we're staying 6 feet away from each other. But social distancing, that kind of implies that we're isolating ourselves and we're not talking to other people, we're not being social. So we can still be physically distant, but we can still reach out to people and still connect with people and connect with people sexually in a lot of different ways too. So I think just like the landscape of how sexual like practices are happening right now with physical distancing, it's obviously very different, and resources that are available are different too. So that's why I think we're here today is to kind of talk through some of those resources, but also give some good tips for how you can really pay attention to your sexual health, right?
Absolutely.
Um, yeah, so before I think, Dave, you're going to tell us a little bit more about some other resources that are available in the DMV. I can start real quick by just talking about what Whitman-Walker's been doing and how that transition's kind of happened. Does that sound good?
Yeah, absolutely.
Cool. All right. So I think the biggest change that we have seen, like I said, is that we're not doing our walk-in STI HIV testing right now. However, we do have actually a hotline for any patient with symptoms or an exposure to an STI through our GMHW clinic. So GMHW, if that stands for our Gay Men's Health and Wellness Clinic. And typically they every Tuesday, Thursday, and also Fridays down at our Max Robinson Center. Typically that's where they're located, and it's an awesome place where people can go to get free testing, free treatment, and a lot of other things done, right? Since we don't want people coming in, obviously, to our clinic right now because of physical distancing, the stay-at-home order, all these things. We have a hotline now that you can call where we can connect you basically to a provider who can then like evaluate a possible STI symptom and then prescribe you the treatment. So you can just go to the pharmacy or even get it delivered because our own pharmacy does delivery. The only caveat to that is that you do have to be a patient with Whitman-Walker already or have already been to our GMHW clinic before. So those are the two things before. So if you're a Whitman-Walker patient, or if you've seen someone at the GMHW clinic in the past, then you're good to go. You can call this number and we can basically do that whole process with you. Otherwise, Dave can tell you about a few other resources that we have, and also call that number below because we can direct you to a whole bunch of different things. So I guess I should probably say the number people can call, right?
Yeah.
I know, I'm like typing it up a lot. But the number is 202-745 6175. So that'll get you connected to what our GMHW clinic is doing through telehealth right now. So since I think that's our Whitman-Walker update there, what are some other resources then, Dave, for people who are looking to care about their sexual health here in the DMV?
Yeah, absolutely. So there's a couple options. So we have Unity Health that is located on 14th Street. Actually, that address is 3020 14th Street Northwest. And the current services they're providing are, STI, HIV testing, and you can actually get that through, walk-in or appointment, which is good. A lot of people aren't still having, walk-in appointments, walk-in. And so that's good. So the phone number to reach them to make an appointment if you need to is, 202-469-4699. And you can go Monday through Friday, 8 a.m. to 5 p.m. So that is a great resource.
Yeah, definitely.
Walk-in hours are at 8 a.m., 1 p.m., and then 5 p.m. So you can call if you have more questions about that. And another resources we're familiar with is Medics USA, which is located at 1700 17th Street. And they are also offering STI and HIV testing. Again, walk-ins and appointments are available. So you can call 202-483-4400 to make an appointment or just drop in if you need to. And that is, you can go Monday through Friday, 9 a.m. to 9 p.m. So that's like a big range. And then on Saturday and Sunday, they're available at 9 a.m. to 4 p.m. So a couple of resources, if you're not a current Whitman-Walker patient, that, everybody's so focused on this, pandemic and COVID-19, but there are still other health things that we have to be concerned about. These are a couple of options that you can utilize during this time.
Totally. Yeah, so I think another good resource that I definitely want to point out. So those two are I think walk-in services are really important right now too, because I know some people might not have access to a phone or things like that. So I think most places, at least from what I've heard, it's if you've got a phone, call ahead. I know things are always changing with this pandemic. Hours might change, things like that. So I would say call ahead, but those are some two walk-in services that I think are important. That's why we wanted to mention them. And the other place that we have is DC Health and Wellness, because they're also still doing STI treatment, and you do not have to be an established patient there either. So that's another good place to go where, again, just call ahead, and then they can get you for an appointment where you can go in and not have to be a patient there too. And then we also have a comment here. It says, obviously with changes being so constant, should you call before dropping in? Yeah,
Yeah. Oh,
call
no.
before dropping in. I think that just makes the process better.
Yeah. And then I mean, these places are still health clinics, right?
Yeah.
And so, they may be seeing other patients. So you also want to be cognizant of that. So calling ahead, asking questions would definitely probably make you a little more safe.
Yeah.
'Cause you don't know where
Yeah,
you're going.
because you want to protect yourself and you also want to protect all the workers that you're going to be going into there. So calling ahead, maybe they'll have a different process where you are just coming in to, be evaluated for a possible STI and do treatment there. That could be a different process than, walking in the lobby and possibly exposing yourself or, having to interact with someone who may
Yeah.
have been exposed to COVID. So yeah, call ahead, basically.
Yeah. And Gorgeous Doc just dropped in the comments that Children's National Adolescent Health Center have televisits and case-by-case appointments. So thanks for, dropping that resource here. If
Yeah.
you have any additional resources that you know about, please feel free to drop them in the comments as well.
Totally. Yeah. And we have a whole long list of resources. We don't want to sit here and bore you all with saying this is the hour for this, and this is where you can call to get this appointment. But if you give us a call at that number below, then we can connect you to whatever resource is best for you for sure.
Yeah. So, in addition to calling that number, what are some other things people can do from home to protect their sexual health?
Yeah, totally. So I think one, I want to also talk about we've been discussing basically testing as um, a means of protecting your sexual health, and it's a really important means. So I guess I'll just finish that because there are some at-home testing options that are available, even over the counter. So there's something called OraQuick, which is the over-the-counter HIV test that's offered at a lot of different CVS's, also online and a few other different places too. And what that is, it's like an oral swab where you just swab like this and you put it in a tube, wait 15, 20 minutes for the result to come back. And then you'll know your status. So if that's an option, obviously, if you do want to know what your HIV status is at that time. I will say those tests can be pretty expensive though. They could range anywhere from $80 to up to $200. So that is pretty pricey, I would say, for a lot of people out there just to know your HIV status. So, and the thing is too, I am an HIV and STI counselor at Whitman-Walker in addition to just doing social media outreach. So I have been trained to do HIV testing, to connect people to resources about HIV and STIs, to walk someone through what it means to be newly positive for HIV. So you're not going to be supported possibly through a really tough situation maybe that you might be going and testing yourself at home. So I think it's really important to still reach out to those resources, call that resource line if you are interested in doing any HIV and STI testing, because then you'll be with the professionals and they'll walk you through that whole process. But it is an option that I wanted to make sure people know about.
Thanks for sharing that. And I also know Everly, they'll mail them right to your home, so you don't have to leave.
Mm-hmm. Definitely.
It's definitely an option, especially for people who want to reduce their risk of exposure of COVID.
Yeah, and I think totally. And I think the other thing that's important to mention too is that say you do an at-home STI test, right? So you do the STI test, but then you have to send it out, and then you're waiting for could be up to a week, could be even more for the results to come back. If you walk in somewhere and you're presenting a symptom, odds are they're going to give you treatment right on the spot. So it'll clear it up much faster and you'll feel much better basically sooner rather than maybe waiting for the result to come back. So whenever we have someone come to us normally who has an STI symptom, we direct them to treatment immediately. That's our protocol because we want to make sure people are getting better and they're not just waiting for the result to come back. So I think that's another important thing to say about that at-home testing.
Cool. Good.
So
thanks for sharing those options.
yeah.
Even though we have, those options, it's still, limited resources right now. So,
Mm-hmm.
what are some other ways that we can, practice safer sex?
Mm-hmm. Yeah, definitely. So there are a lot of different ways. We've had some lives actually in the past about this. I know Marshawn and Will did a really good one. It was like our first one that we did that talked about a lot of this. So this will be just a quick run through of some different tips too. And these are also for people who maybe who have not tested positive and have not come into contact with anyone who have tested positive for COVID. So these are for people who are not positive right now, and are basically different practices you can do to reduce your risk for possibly contracting HIV or another STI. So first, we definitely want to say that it's important to abide by stay-at-home orders that are out there right now. So that's in DC, Maryland, Virginia. We want to make sure that you're following the law, following all the orders of like Mayor Bowser. And again, it's about risk reduction, right? So it's about what practice is going to work best for you. So first, you are your safest sex partner. So when you maybe are not able to go see your quarantine bae, to see your partner, to see anyone else who you would have sex with, masturbation, I think, is just the best possible thing you can do right now to protect yourself from COVID exposure. So basically, I think we're starting from like the ideal of like, what could you ideally be doing to protect yourself? And then also acknowledging reality and saying people are still going to want to have sex. People are going to leave their houses to do so. So like, what are some things to reduce your risk here, right? So I think other ways, if you are staying at home, obviously masturbation, you can still connect with someone, while you're at home. You might not be in the same physical space, but you could talk over the phone. Do you have sex toys available? Doing all like using those newer techniques, exploring some new fetishes that you might have, things like that on your own. Like those are really things that we encourage right now. So I would say outside of like not seeing anyone, if you are going to see someone, it would be best if it were someone that you are quarantining with. So someone who's in your household, who is basically still within the same circle of exposures. So since you're living together, you're basically only possibly getting exposed to the same people. So I think that's a good practice too. And if you are going to go have sex, limiting the amount of partners and limiting the amount of exposures is really important. So if you're going to go venture outside of the house and see a partner, maybe seeing someone who's also maybe just been quarantined by themselves, because then you're really not increasing the amount of exposures you might have had outside of that person, right? Maybe driving there if you're going to do that, as opposed to taking public transit and running into different people. I think they're just like, you just kind of have to think about what your possible exposure methods are like to COVID. And then from there, like do what you think is best for you, obviously, like stay safe, stay protected, but at the same time, you need to take care of yourself. And obviously it's stressful times. People are stressed and they're going through a lot. And a lot of times sex can be a good escape from that for people, a good stress relief. So like, it's all about knowing the facts, knowing about what works for you, and reducing your own personal risk, right?
Yeah.
So I think that covers a lot of it.
No, it does. And I saw a comment that asked, do we have, did you all have sexual health tips online somewhere?
We do, yeah. So we actually just posted today a whole amazing graphic with a lot of cool sexual health tips on our social media. You can also check out our website. It's not on there too, which has you would think I just went in depth a lot. We went even more in depth about some good things you can do. Practice safe sex during COVID-19. So yes, thank you. Thank you for asking that.
Cool. And even with, our sexual health practices, do we still have, I'm assuming you also have to maintain the washing your hands and all that stuff.
Oh yeah.
Before and after.
Before and after, for sure. 20 seconds, sing happy birthday twice. We were discussing before, Soul, one of our influencers, is an incredibly talented singer. So whatever time she's been washing her hands for 20 seconds and singing a song. And someone, when I was chatting before, was like, JJ, you should sing for us. I was like, no, that is not happening. You do not want to hear me sing here. But yeah, 20 seconds before and after, and washing your sex toys with, same thing with just soap and water for 20 seconds. Great practice if you're going to do that as well.
Gotcha. Okay. So you mentioned a lot of tips, a lot of tricks, good advice. You
Oh,
know,
yeah.
where does condoms come into play into all of this? Like, where do we get?
Yeah. So condoms come into play, I think mostly in the same way that condoms come into play normal times when you're caring about your sexual health, right? So, firstly, condoms can be used to prevent COVID-19 because the two ways that COVID can be transmitted are through saliva and through fecal matter. So, basically, like if you're kissing someone, if you are rimming someone, if you're having like anal intercourse, there is that chance there that COVID-19 could be transmitted because that's like the body fluids that it lives in. So condoms are a good way to prevent it there. But then on top of the fact of COVID-19, condoms are just a great way to prevent HIV and STIs, right? So we have male condoms. So those are like the standard condoms. And then we also have insertive or female condoms that are great ways that you can protect yourself. And I think with that too, it's again good practice to wash your hands when you're using condoms, things like that. And using lube is incredibly important when you're using condoms too, because it minimizes the risk for possibly breakage or anything like that. And it also protects against pregnancy too. So I know people are going to be staying in together a lot more these days. Pregnancy maybe it was not going to be the top of the list for a lot of people right now, so condoms can be a good thing to prevent that as well.
Gotcha.
Yeah.
All right. So let's say that I'm with a partner who isn't, so sure or excited about using it.
Mm-hmm.
How can I get them to use one, if that's what I want to do?
Yeah. So we kind of when we talk about this with clients, we refer to it as condom negotiation, which makes it seem like this intense, like we're sitting at a table and we're negotiating our best situation to come out at the end at the bargaining table. But I think it just really comes down to being one informed about why you want to use a condom, and then also just being able to communicate that with your partner and establish that trust, right? So I think the best way to do this is to give everyone a few examples. Also, definitely comment if you have experienced something similar, because we definitely, want to give everyone as many examples as possible and kind of break down that stigma of, it can be weird to use a condom, or it's uncomfortable to use a condom, things like that. No, that's not the case. So tons of different examples. And I think Dave and I can do a little role play, fun, a little exercise with y'all now, to give you a few examples that we talked about.
Yeah, so we'll do a little role play. And if you have any scenarios, please drop it in the comments. I think it'll be fun to run through those.
Mm-hmm.
So, let's say, I'm on the pill.
Mm-hmm.
I'm on the pill. I say to you, like we're having sexual or about to have
Mm-hmm.
direction. I say, oh, I'm on the pill, don't worry. What would your response be to that?
So I would say my response would be,
Pill could be anything, right?
That's what I'm saying. It could be, I was like, what pill firstly? So I would say if it's PrEP, if the pill is PrEP, I think a good response would be like, obviously, I trust you, but PrEP only prevents against HIV, not other STIs, right? So I just want to make sure that we're protecting both of us here. I think that's a good way to go about it. If you're saying the pill is birth control, again, just establishing trust, saying, hey, I trust you. Again, I just want to protect both of us here. Because again, birth control also does not protect against STIs or HIV. So using condoms, we always say it's just another added layer of defense that you have for your sexual health. That could be on top of PrEP, that could be on top of getting tested. It's another way just to protect yourself. So I think just a little tool in your sexual health toolkit.
Yeah, good. So, so what if, for me, that response wasn't good enough and I came back with, well, we already, did it once,
Mm-hmm.
condom, so
Yeah. I would say, hey, that was a mistake. I didn't want to do that last time. I could easily say that. I could say I was worried the entire time we didn't use a condom, right? I was worried that, say, I could get pregnant, I could get an STI. Basically saying, even though it happened that past time, that doesn't mean I'm comfortable again. I think that goes back to conversations about consent too, right? Just
Mm.
because said it was okay an hour ago, a day ago, a week ago, doesn't mean that's still the case now. So keeping open that open line of communication about consent, especially with condoms, I
Yeah,
think that's how I'd approach that situation.
got it. So, I might come back with one of these or like, oh, well, I always pull out in time
Oh
to
yeah.
worry.
Well, I would say I think the nice thing to say, the public health expert in me wants to say the fact that withdrawing, pulling out, whatever you want to say, is
Did
just
you call
not
it? I'm sorry.
effective. Whatever you want to call it, right? It's just not effective in
Yeah.
terms of preventing pregnancy and HIV and STIs. We have some fun facts down for you later. But I would say, if you said to me, well, I pull out on time, don't worry, I think
Yeah.
a good way to also say back is saying, well, I think if we're using a condom, then you don't have to pull out and it could feel even better.
Yeah.
Like being positive about the experience, saying it'll be better for both of us and for our pleasure. That's a great way to spin it.
Yeah. No, that's good. That's a good one. You know, so what if I'm, one of those people who, like to use this statement, oh, I don't feel anything when I wear a condom, so I don't really
Mm-hmm.
condom. And so, my argument there is like, oh, well, I'm not getting the type of pleasure that I like to
Mm-hmm.
be your response.
So I think my response there would just be, again, we want to still be positive about sex and we want to be positive about the experience. So if it's not pleasurable for that person, we first want to acknowledge it and be like, oh, I'm sorry that it hasn't been pleasurable for you. This is still important to me. It's still important that we use a condom because I want to protect myself. Let's maybe try a different brand that will work better. There are so many different types of condoms out there. Maybe one that fits better, maybe a lube that will be better. I think let's just try to explore some different options and see what works best for both of us. I think that's the way that you can, even when you say, oh, I don't feel anything when using condom, it's not good for me. There's not one size fits all here, that it is very much you need to find that what works best for you, and exploring that together could be a fun experience, right? It could be good to be like, hey, let's try this one today. Oh, I got this lube today that I think, I got a good recommendation from my counselor at Whitman-Walker and said to use this lube today. And I think that's a great way to go about it and just keep the positivity going.
Yeah. No, that's good advice. I mean, I like the role play idea because we do find
Mm-hmm.
in those situations. And I saw some great comments here, saying condom negotiation, can bring people closer together.
Yeah,
Most people think it pushes away, but we have a comment here that validates that it can actually bring you closer together and really give you that ownership of your body and
totally.
like that my body my choice type of thing. So that's amazing.
Totally.
So you mentioned you have some fun facts for us.
Oh, we have fun facts for you. We definitely do. Yeah, so I think these fun facts are just other good things. If you're someone who is facts are a good way to kind of validate what you're feeling, I think these are good tools that you can use in having those conversations too.
Hmm.
Um, so first fact we have for you is that you cannot see or smell most STI infections. So that means you can't just look at someone and know if they have been infected or not. So knowing that, I think that is a convincing argument that maybe you should use condoms, because you can't just look at someone and be like, well, clearly, you're not using, or you do or do not have an STI. So that's a
Gotcha.
good thing to know.
Yeah, and I have one. So, like we mentioned, the pull-out situation. So
Mm-hmm.
withdrawal, or pulling out, is not effective in preventing pregnancy. So about 27% of folks become pregnant in the first year when their partners, pull out. So, fun fact, it's not effective. You might want to practice something else.
Yeah, and going off of that, I would say our next fun fact, I don't know if it's there's no number involved. It's not a fact, but or I mean it is a fact, but it's not a statistic. It's just having a child, if you're, with this whole pulling out thing, it costs a lot of money. It's a big decision to do. So I think if you do not want to become pregnant because you don't want to have a child because it costs a lot of money,
Yeah,
incredibly compelling.
yeah, absolutely.
Yeah.
She are definitely expensive.
Yeah.
Um, and so, another fun fact, let's keep it real. People are infected with STIs like every single day.
Hmm.
So, during this time, though, like this pandemic, resources are limited. It can be very tricky to get tested and treated during this time. So, we want to keep that in mind. That is not a fun fact, but it's most certainly a fact of our
Yes.
situation and the time we are dealing with.
Hmm.
Yeah. So, we've talked a lot about condoms, and we're practicing physical distancing. That means limiting, where we go. So, if I, want to use condoms, how would I get them like during this time?
So I have the resources for you. Don't worry. I definitely want to give a shout out to Monique, who's one of our coworkers who put a lot of the content together for this presentation. She said, getting more bang for your buck. I think that's a great way to, to explain where to get condoms here. So there's actually a company right now called Promocent that is sending customers a pack of 4 condoms for free. All you have to do is go on their website, and place your order, and that's pinned right at the bottom there. So head to that website for your free pack of 4 condoms. It's like while supplies last, but at the supplies, it's like 250,000 condoms or something like that. So if you head there, I'm sure you'll be able to get some condoms. We basically just want to avoid people going to the store, the local pharmacy, to get condoms right now because we want to limit the amount of possible exposures that are going on around COVID-19. So other places you can order them online and get them delivered. Amazon obviously is a good place where you can get a lot. They have different brands, different sizes, textures, all of that. So you can find your favorite, maybe test a few things out. People have a lot of
You can
times on their
also
hand.
order food from Amazon if you need
Hmm.
it.
Oh yeah. And you can order them and not that's not just the standard condoms. There are also insertive condoms, the FC2s, or female condoms, on Amazon too. So those are different online places. And they got a comment only in the DMV. No, I don't think it's only in the DMV. That company said you could ship them anywhere, and at least from what we did research on, it shouldn't only be in the DMV. But good question.
Yeah. All right. So, we told you a little bit of, about how you can incorporate condoms into your practices at this time.
Mm-hmm.
Get some of those, due to limited resources, and we definitely talked a lot about, how to get HIV and STI resources during this time. So,
Yeah.
I just want to sum this conversation up with, it is very, very, very important to continue our physical distancing. Um, that's really the only way that we can flatten the curve that we've identified at this time, right? So we need to be sure that we are continuously practicing that 6 feet away, social distancing as much as we can. Please.
Physical distancing as much as we can.
Yeah.
Yeah, definitely. So I think that we got to, we're alone together is what I've seen going around. We might be practicing that physical distancing, but we're all in this together to flatten the curve, right? Other things to keep making sure you're doing: washing your hands. CDC now recommends that you wear a face mask whenever you're leaving your residence. So there are tons of resources online, on our website, calling that number for, how to make your own face mask, things like that. And wiping down commonly touched surfaces because COVID-19, there are these things called like fomites, which are little particles that can carry the virus and remain on surfaces for, it's unclear really how long they'll remain on surfaces, but like wiping down things like light switches, your phone, doorknobs, things like that. Important to keep doing that too.
Yeah, absolutely. I've definitely made it a point to like, I usually wouldn't wipe my phone down as much, but now I'm
No,
like,
me either.
I wash my hands. I kind of like wipe my
Mm-hmm.
well, because it's always in my hands. So I kind of figured
Yep.
that practice. So, another thing, we've added our resource line at the bottom. It's 202-797-4439. You can call that number for any of the information we discussed today.
Mm-hmm.
And you can also go to our website at whitmanwalker.org for the most up-to-date information on COVID-19 services and other resources that we have available.
Yeah, it's all there. We're here for you.
Yeah, so thank you all for tuning in. And I see a hashtag here that says alone together. So we'll end on that note. Thanks for being alone together with us.
Yes, for sure. Thank you for tuning in. Make sure you're tuning in for all of our lives that we're having now. We've got them planned daily going forward. So tomorrow we've got one on PrEP and specifically PrEP for women. Thursday we're going to do one on like LGBTQ determinants of health during COVID, and then Friday we're going to do one actually in Spanish because we
Oh,
know
no.
we want to make sure we were reaching out to our Spanish speaking community. So tune in for all those.
Whitman-Walker. We are great.
We
So
gotcha.
continue to follow us on Instagram, Facebook, Twitter, at Whitman-Walker. We're going to continuously post, the resources we have available and the
Mm-hmm.
information about our live sessions. So stay tuned.
Definitely. All right. I think we're good. Good talking to you, David.
Nice talking to you, JJ. Stay safe.
We'll see you soon. Yep. Stay safe, everyone.
Bye.